The hallway smells like industrial disinfectant and old coffee. Helen Reeves pushes her cleaning cart down the surgical wing corridor, wheels squeaking with each rotation. Left rear needs grease. She knows every sound in this place. The autoclave hum 3 doors down, the broken vent rattle in OR7, the hydraulic sigh when residents burst through double doors at shift change. She's 52, gray hair pulled tight, scrubs faded from 1,000 washes. She moves with an economy of motion uncommon in civilian cleanos. No wasted steps, no hesitation. It's 5:47 a.m. She's mopping outside the residence lounge when the door flies open. Dr. Marcus Chen nearly steps in her bucket. 28, sharp as his pressed collar, trailing 2 interns like ducklings. Coffee sloshes in his hand. Jesus, do you have to clean during rounds? Helen moves the mop without looking up. Sorry, doctor. Chen's already passed her, explaining laparoscopic technique to his followers. One intern, tall, nameplate-reading Rodriguez, glances back with an apologetic half-smile. Helen returns to the tile. The mop moves in efficient arcs, northeast to southwest, 3-inch overlap. The pattern she learned in field hospitals where blood needed cleaning before the next wave arrived. She doesn't think about that anymore. The cardiac monitor screams from OR3. Helen's hand stops mid-stroke. Her head tilts slightly, reading the alarm pattern through the closed door. VTAC, unstable. Maybe 30 seconds before someone realizes the crash cart in that room has a dead battery. She's moving before the thought completes. The backup cart sits in the supply alcove behind outdated intubation kits that should have been discarded 6 months ago. Helen pulls it into the corridor, positions it outside OR3, just as the door slams open and a nurse sprints out, wild-eyed. Crash cart. Here. The nurse grabs it without thanks, wheels it inside. Through the porthole window, Helen watches them shock the patient. Once, twice. The monitor's pitch changes. Sinus rhythm, unstable but viable. Dr. Sarah Okonkwo emerges 4 minutes later, peeling off gloves. She sees Helen standing there with her mop. Lucky you had that cart ready. Then to the nurse behind her. Someone check the equipment logs. 2nd dead battery this month. She walks away. Helen returns to mopping. Rodriguez lingers in the doorway. He looks at Helen, then the backup cart, then back at her. His brow furrows. Ma'am, how did you know? Rodriguez, Chen's voice echoes down the hall. We're not paying you to chat with housekeeping. The intern flushes, hurries away. Helen watches him go. She bends down, retrieves something from beneath the cleaning solution bottles on her cart. A small patch of fabric, tan, frayed. Combat medic insignia, 75th Ranger Regiment. She rubs her thumb across it once, then tucks it back. The mop returns to its rhythm, northeast to southwest, 3-inch overlap, like nothing happened. On Helen's left wrist, beneath her frayed scrub sleeve, sits a watch. Not the cheap digital kind other cleaners wear. This one's analog, military grade, scratched crystal, band replaced twice, but the face original. It still keeps perfect time. She checks it. 6:14 a.m. Shift change in 16 minutes. She works faster. Muscle memory. The kind learned when speed means someone lives. At 6:28 a.m., Helen empties trash in the surgical staff lounge. Dr. Chen sits with Dr. Okonkwo and an older attending. Dr. Philip Kraus, 60, silver-bearded old-school surgeon with a god complex. Outdated thinking, Chen says, gesturing with his phone. Kraus still teaches the Pringle maneuver for hepatic hemorrhage. Every modern protocol says go straight to vessel ligation with clips. Kraus snorts. Protocols written by people who've never had their hands in a liver falling apart. It's slower. Time is perfusion. Every second wasted clamping portal triads is a second you buy to see the field, but you wouldn't know that. You've done what, 30 hepatic cases? 42. I've done 800. Kraus sips coffee. When you've lost a patient because you were too modern to be careful, call me. Chen's jaw tightens. Medicine evolves. Physics doesn't. Pressure, flow, time. Learn basics before worshipping the new. Helen ties off the trash bag, lifts it silently. As she passes, Okonkwo mutters, "Old guard never dies, just gets bitter." Chen laughs. Helen pauses at the door for a heartbeat. Her hand rests on the frame. She could say something about the 4 hepatic resections she assisted on in a field surgical tent outside Kandahar. About holding manual pressure on a portal vein for 11 minutes because they were out of clamps and the surgeon was working with a headlamp and prayer. She doesn't. She leaves. Helen pushes her cart toward the service elevator. The hospital wakes around her. Shift change complete. New chaos brewing. Residents scatter like startled birds. She passes a bulletin board. Pinned among hospital announcements and CDC posters is a photo from last month. Surgical team celebrating some award. Chen front and center, grinning. Kraus in back, arms crossed, not smiling. Helen doesn't appear in any photos. She steps into the elevator, doors close. Her reflection in the steel, a cleaning woman. Invisible, 52, gray and unremarkable. The patch in her cart pocket feels heavier than it should. The elevator descends. She thinks about the watch on her wrist, about the ring in her other pocket. Tungsten carbide, scratched, no inscription needed. Lieutenant Marcus Webb, killed by IED outside Mosul 3 weeks before their wedding. She'd held his hand while he died, 23 minutes. Long enough for him to stop recognizing her. Some things you carry, some things carry you. The elevator reaches the basement. Helen pulls her cart out, begins restocking surgical supplies. Her hands move automatically, placing hemostats in trays of 12, sorted by size, the way surgical techs prefer. She's been doing this for 7 years. 7 years of being invisible. 7 years of pretending the 34 faces in her phone don't exist. 7 years of believing if she stopped being Sergeant Reeds, she could stop remembering. It hasn't worked, but she keeps trying. Helen is restocking surgical kits in the autoclave room when she smells it. Not a sound, a smell. Copper, worn, heavy, blood. She stops mid-reach, hand frozen over a tray of hemostats. Her breath catches. The smell isn't real. The blood is 2 floors up, properly contained behind sterile protocol. But her body doesn't know that. Her hand trembles. She closes her eyes. Dust in her mouth. The taste of it gritty and hot. A Humvee on its side, smoking. Metal twisted like paper. The gunner. Private. Inner Private Calhoun, 22 from Nebraska, hanging upside down in the hatch, trapped by his harness. Femoral artery open and pumping. Her hands, slick and red, fingers inside his thigh, pinching off the vessel because there's no time for a tourniquet. No time for anything but pressure and prayer. Stay with me, Calhoun. Stay with me. His eyes wide, scared, trusting. Sergeant Reeves, I can't feel. You're fine. Look at me. But he wasn't fine. 2 minutes later. He stopped looking at anything. Helen opens her eyes. The autoclave hisses, releasing steam. She blinks the memory away, forces her hands steady. She finishes stacking hemostats, 12 per tray, sorted by size. Her fingers move automatically. Muscle memory older than this job. Behind her, the door opens. Oh, sorry, didn't know anyone was down here. Helen turns. Rodriguez, the intern, holding a requisition form, looking slightly lost. I'm just restocking, Helen says quietly. I can leave if... No, it's fine. I just need questions. Chest tube kit, 32 French. We've got a pneumothorax coming up from the ER, and main supplies out. Helen doesn't hesitate. She crosses to the far shelf, 3rd row, pulls the kit without looking. Hands it to him. Rodriguez blinks. How did you? Been here a while. He takes the kit but doesn't leave. He's watching her now, really watching. The way her hands moved. The certainty. You knew exactly where that was, without checking labels. Helen shrugs. I restock this room every day. Right, yeah. His tone says he's not convinced. It's just, earlier, with the crash cart. You knew which OR needed it before anyone called. Helen picks up another tray, keeps working. Lucky guess. Was it? She doesn't answer. Rodriguez shifts his weight. My dad was a Marine, deployed 3 times. He moves like you do, efficient, like every motion has a purpose. Helen's hands still, just for a fraction of a second. Your father sounds like a smart man, she says evenly. He is. He also doesn't talk about what he did over there. Just like you don't talk about... Rodriguez, Dr. Chen's voice, sharp and impatient, echoes down the stairwell. Coming, Rodriguez calls back. He looks at Helen one more time, something like respect flickering in his eyes. Thanks for the kit. He leaves. Helen exhales slowly. She reaches into her scrub pocket. Pulls out a ring, tungsten carbide, scratched. No inscription, but she doesn't need one. Lieutenant Marcus Webb, killed outside Mosul 3 weeks before their wedding. He'd been embedded with her unit as a logistics officer. Wrong place, wrong convoy. She'd held his hand while he died. 23 minutes. Long enough for him to stop recognizing her. She slips the ring back into her pocket. Some things you carry, some things carry you. That afternoon, Helen is cleaning the surgical observation gallery, tiered seating where med students watch procedures through soundproof glass. Below, in OR2, Dr. Krauss is performing an exploratory laparotomy. Bowel resection complicated by adhesions. It's not going well. Helen can see it in the way he's moving. Slower, more deliberate. The tissue's friable, tearing under tension. A med student next to her mutters to his friend, "Why doesn't he just use the harmonic scalpel?" All that manual dissection is Stone Age. Helen stops wiping the bench. She looks down at Krauss, watches his hands. The way he's using blunt dissection, finger by finger, feeling his way through scar tissue that would shred under ultrasonic vibration. Because scar tissue isn't uniform, Helen says quietly. The students look at her. If you use the harmonic there, you risk thermal injury to structures you can't see. Bowel, ureter, iliac vessels. Her voice is calm, clinical. Manual dissection lets you feel the planes. It's slower. But it's controlled. The first student blinks. How do you? Helen realizes what she's done. She straightens, returns to wiping the bench. I've just seen a lot of surgeries, from up here. But the students are staring now. One of them is pre-med, military track. He recognizes something in her tone. The way she assessed the field. Ma'am, were you Excuse me, Helen says. I need to finish the third floor. She leaves quickly. Behind her, the students exchange glances. At 2 p.m., Helen takes her break in the basement locker room. She doesn't go to the cafeteria, doesn't socialize. She sits on the bench, eats a sandwich she packed. Turkey, no condiments, wheat bread. Military rations taught her to eat for fuel, not taste. While she eats, she does something she's done every day for 7 years. She opens her phone, scrolls to a folder of photos. 34 faces, her unit. Some smiling, some exhausted. Some mid-action, blurry, caught in chaos. 12 of them are dead. She looks at each photo, every single one. It takes 4 minutes. Then she closes the folder, finishes her sandwich, and goes back to work. Helen is mopping the second-floor corridor when Dr. Okonkwo walks past, phone pressed to her ear, frustrated. I don't care what the schedule says. We're short 2 surgical techs tonight, and Chen's got a splenectomy at 6. If we don't have coverage... She pauses, listens. Fine, but if this goes sideways, it's on staffing. Not me. She hangs up, mutters something under her breath. Helen keeps mopping, but her mind is already running triage protocols. Splenectomy, trauma or elective. If trauma, high likelihood of complications. If they're understaffed, margins shrink. She checks her watch. 3:47 p.m. 2 hours, 13 minutes until Chen's case. She doesn't know why she's counting, but she is. Helen is cleaning the scrub room adjacent to OR5 when the trauma comes in. She hears it before she sees it, the controlled thunder of a gurney at speed, the staccato callouts from paramedics, the metallic slam of OR doors. 22-year-old male, motorcycle versus SUV, blunt abdominal trauma, BP dropping, 70/40 and falling. Helen's hands stop. She moves to the observation window. Through the glass, she sees them transfer the patient to the table. Young kid. Helmet saved his head. Nothing saved his abdomen. Dr. Chen is scrubbing in. Fast. Confident. Rodriguez and another intern are gowning. 2 surgical nurses, both junior. Helen recognizes immediately. The hospital's short-staffed. No senior scrub tech. Chen doesn't seem to notice, or care. Helen's pulse ticks up, just slightly. The surgery begins at 6:11 p.m. Chen's hands are fast, confident. He makes the midline incision with precision. Scalpel, cautery, retractors. The field opens. Blood wells up, dark and heavy. Suction. The junior nurse suctions. It fills immediately. More blood. Lap pads. 4. E packs the abdomen. Soaks through in seconds. BP? 62/38, dropping. Helen watches from the observation gallery. She's not supposed to be here. Her shift ended 20 minutes ago. She stayed. Her fingers grip the railing. Chen isolates the spleen. It's shattered, grade 4, maybe 5. Capsule torn, parenchyma pulped. He starts mobilizing it, running the bowel, trying to get proximal control. But the bleeding won't stop. More suction. Rodriguez, retract here. No, here. Rodriguez pulls. The retractor slips. Blood obscures the field again. Pack tighter. I need visualization. The anesthesiologist's voice cuts through, calm but firm. Systolic's 50. He's not going to tolerate much more of this. Chen's jaw tightens. He's moving faster now, clipping vessels, ligating branches. But for every bleeder he controls, 2 more open up. The spleen is friable, tissue disintegrating under his instruments. Helen leans forward. Her breath fogs the glass. She knows what's wrong. BP 46 systolic. Push another unit. Hang the oneg. We're on the 3rd unit. Then get a 4th. Chen's voice cracks slightly. The confidence is fracturing. He's trying to remove the spleen piecemeal now, fragment by fragment. But the hilum's a mess. Short gastric vessels torn, splenic artery retracted into the retroperitoneum. Everything soaked in blood. I can't see. I can't. Rodriguez, pack here. Here. Rodriguez tries. His hands are shaking. Helen's fingers are white on the railing. She knows what he needs to do. Pringle maneuver. Clamp the hepatoduodenal ligament. Stop all inflow to the liver and portal system for 60 seconds, maybe 90. Just long enough to see the field, identify the bleeder, get control. It's old school, basic. The exact technique Krauss argued for this morning. The technique Chen called outdated. Helen moves. She's through the observation door, down the stairs, into the scrub room, before her conscious mind catches up. She doesn't gown, doesn't scrub, just pushes through into the OR, still in her cleaning scrubs. You can't be in here, the junior nurse starts. Helen ignores her, walks straight to the table, looks at the field, looks at Chen. Pringle maneuver, she says, calm, certain. Chen's head snaps up, eyes wide behind his surgical loops. What? Who the hell? You need to clamp the hepatoduodenal ligament. Stop the inflow. 60 seconds. You'll see the field. I don't need. This is a sterile environment. His pressure's 42 systolic. The anesthesiologist says flatly. If you don't do something in the next 30 seconds, he's coding. Chen stares at Helen, then at the patient, then back at Helen. I'm not using some outdated. Pringle, now, or he dies. Helen's voice is flat. Command voice. The kind that moved soldiers under fire. Chen's hands hesitate. Rodriguez looks at Helen, then at Chen. Dr. Chen, maybe? Fine. Chen's voice is sharp, desperate. He reaches for a vascular clamp. But if this doesn't work, it will. Helen steps back, watches. Chen's hands find the hepatoduodenal ligament, the thick bundle of tissue at the liver's edge containing the portal vein, hepatic artery, and bile duct. He isolates it, slides a clamp beneath, closes it. The bleeding slows, not stops, but slows. Enough. Suction. Now. The field clears, and there, retracted deep into the retroperitoneum, the the splenic artery, torn and pumping. Chen sees it, clamps it, ligates it, ties it off. 60 seconds. He releases the Pringle clamp, no new bleeding. The room exhales, BP stabilizing, 58, 62, 68. Chen doesn't move for a moment, just stares at the field, then at Helen. Who the hell are you? Helen doesn't answer. She's already walking toward the door. Rodriguez is staring at her. So is the anesthesiologist. So is everyone. Nam, wait. Rodriguez starts. But Helen is gone. Outside the OR, Helen leans against the wall. Her hands are shaking now. Adrenaline bleed off. She hasn't felt this in years. She checks her watch. 6:34 p.m. 23 minutes. The kin will live. She pushes off the wall, heads toward the service elevator. She needs to leave. Now, before someone asks questions she can't answer. But as the elevator doors open, she hears footsteps behind her. Hey, wait. She turns. Rodriguez. And behind him, emerging from the scrub room, still in his surgical gown, is Dr. Chen. He's staring at her like she's a ghost. You knew, Chen says quietly. You knew exactly what to do. Helen doesn't respond. That's not housekeeping knowledge. That's surgical training, field training, military training. Helen's pulse spikes. I clean the ORs, she says. I've seen a lot of... No. Chen steps closer. His arrogance is gone. There's only confusion now, and something like respect. No one who just watches walks into an OR and calls a Pringle like that. That was muscle memory. That was experience. Helen's jaw tightens. I need to go. Who are you? Chen asks. Really? Helen steps into the elevator, presses the button. The doors start to close. Rodriguez catches them, holds them open. Ma'am, he says gently, you saved that kid's life. You don't have to tell us anything, but thank you. Helen looks at him, then at Chen. She nods once. The doors close. Helen is clocking out. The hospital is in its graveyard shift lull. Lights dimmed, corridors empty, except for the soft squeak of nurse shoes and the distant mechanical hum of ventilators. She swipes her badge at the time clock in the maintenance office, collects her coat from her locker. Her hands are steady again. The adrenaline from earlier has faded into the familiar numbness she wears like a second skin. She's almost to the exit when she hears the voice. Sergeant Reeves? Helen freezes. Not her body, her breath. Everything inside her locks down like a breaching charge just armed. She doesn't turn, not yet. She closes her eyes, counts 3 seconds, forces the mask back into place. Then she turns. Standing near the visitor chairs, still in dusty field clothes and a faded jacket, is a man in his mid-40s, lean, weathered, short-cropped hair going gray at the temples. He's holding a hospital visitor badge and a coffee cup, and he's staring at her like he's seen a ghost. It is you. Helen's throat tightens. She knows this face. Not the name. Names fade. But the face she knows. Afghanistan. 2011. Forward Operating Base Salerno. He was a contractor. Private security. Called in for a convoy escort that got hit hard. She'd patched him up in the field. Sucking chest wound. Tension pneumothorax. She'd done a needle decompression with a 14-gauge catheter while pinned down under small arms fire. He'd lived, obviously. I'm sorry. Helen says, keeping her voice flat, clerical. I think you have me confused with. Bullshit. He steps closer, not aggressive, just insistent. His voice drops. Salerno, June 2011. I took shrapnel through the left lung from an RPG fragment. You shoved a needle between my ribs and told me to stop being dramatic while bullets were hitting the truck behind us. Helen's pulse is hammering now, but her face stays neutral. Sir, I'm a janitor. I've never been to. You had a Ranger tab on your sleeve and a CLS bag that looked like it had been through 3 deployments. Your hands didn't shake. Not once. He's not backing down. His voice is louder now. You saved my life, Sergeant. Helen glances around. The lobby is mostly empty, but there's a night receptionist at the desk, and 2 nurses walking past, and Rodriguez. The intern is standing near the vending machines, mid-snack, staring at them both. Helen's stomach sinks. I don't know what you think you remember, Helen says carefully, but you're mistaken. The man's face hardens. You had a ring on a chain around your neck, tungsten. You told me it belonged to your fiancé. KIA 3 months earlier. You said his name while you were working on me, Marcus Webb, because you thought I was going to die, and you didn't want me to die alone without hearing someone say a name that mattered. Helen's breath stops. Rodriguez is walking closer now, listening. I looked you up after, the man continues. Took me 2 years, but I found your unit. 75th Ranger Regiment, 2nd Battalion. You were attached as a combat medic to a Special Operations Task Force. 3 deployments. Bronze Star with Valor. You left service in 2015 after... Stop. Helen's voice cuts like a blade. The man stops. But the damage is done. Rodriguez is right behind him now, eyes wide. Sergeant? Rodriguez says slowly. You're military? Helen doesn't answer. Her hands curl into fists at her sides. She's calculating exits. Escape routes, the same way she used to calculate cover and concealment. The contractor softens his tone. I didn't mean to out you. I saw you walk past the ER earlier, and I thought I was losing my mind. I had to know if it was really you. It's not. Sergeant Reeves. That's not my name anymore. Helen's voice is raw now, stripped. That person doesn't exist. She turns and walks, fast. Rodriguez calls after her. Ma'am, wait. But she's already through the doors, into the parking lot, into the cold night air. By morning, the story has spread. Not officially, not through HR or administration, but through the invisible network that exists in every hospital. The break room whispers, the nurse station gossip, the residents group chat. The cleaning lady isn't a cleaning lady. She's ex-military, special operations, combat medic. She's the one who saved that splenectomy case last night. She knew what she was doing because she's done it under fire. By 7 a.m. when Helen clocks in for her next shift, people are staring, not openly, but she feels it. The nurses who used to ignore her now watch her pass. The residents who used to dismiss her now step aside in the hallways. Dr. Chen is waiting outside the maintenance office when she arrives. We need to talk, he says. Helen doesn't stop walking. I have floors to clean. You're not a janitor. I am now. Sergeant Reeves. She spins on him. Fast enough that he takes a half step back. Do not call me that. Her voice is low, dangerous. I did my time. I'm done. I clean floors. I go home. I don't wear that name anymore. Chen holds up his hands, placating. Okay. I'm sorry. But you can't just. People are asking questions. Administration's going to want answers. Then let them ask. You walked into a sterile OR without authorization and gave medical directives. That's grounds for termination or worse. If they think you're practicing medicine without a license. Helen's jaw tightens. I saved a kid's life. I know. And I told them that. But they're going to investigate. They have to. And when they do, they're going to find out who you really are. I'm no one. You're a decorated combat medic who walked away from the military 7 years ago and has been hiding in a hospital basement ever since. That's not no one. That's someone running from something. Helen stares at him. Says nothing. Chen softens. Look, I don't know what happened to you over there, and I'm not going to pretend I understand. But whatever you're hiding from, maybe it's time to stop. Helen's hand moves to her pocket. The ring, the patch, the weight of things she can't put down. You don't know what you're talking about, she says quietly. Maybe not, but I know you're better than this. Better than mopping floors and pretending you're invisible. Helen turns away. Walks toward the service elevator. Chen doesn't follow. But as the elevator doors close, she sees him standing there, watching her with something that looks uncomfortably like pity. Helen descends to the basement. The fluorescent lights flicker. The air smells like old pipes and steam. She leans against the elevator wall, closes her eyes. The name echoes in her head. Sergeant Reeves. She hasn't heard it in 7 years. She thought she'd buried it. But the dead don't stay buried. Not in her experience. The elevator shudders to a stop. The doors open. Helen steps out into the dim corridor, pulls her cart from the storage room, and starts her shift. But her hands are shaking again. And this time, they don't stop. Helen is restocking the ED supply closet when the scanner crackles overhead. All available personnel to Trauma 1. Multi-vehicle MVA, 5 critical incoming. ETA, 4 minutes. The ED erupts. Nurses sprint. Residents scramble. Gonies slam through doors. The controlled chaos of a level 1 trauma center snapping into high gear. Helen stays in the closet. This isn't her job. She's just the woman who cleans up after. But through the doorway, she can see them prepping. And she can hear the radio updates. First ambulance 2 minutes out. Passenger vehicle versus semi-truck. Heavy extrication. Multiple GSW equivalent blunt traumas. GSW equivalent. Gunshot wound level energy transfer. Helen's hands still on the shelf. She knows what that means. They come in waves. First gurney. Middle-aged woman. Unconscious. Flail chest. Bilateral pneumothorax. Intubated in the field. Pressure dropping. Second gurney. Teenage girl. Awake and screaming. Open tib-fib fracture. Bone through skin. Blood pooling on the backboard. Third gurney. Elderly man. Ashen. Distended abdomen. Rigid. Probable intra-abdominal hemorrhage. Fourth. Young man. Early 20s. GCS 7. Unequal pupils. Head trauma. Bad. Fifth. Pediatric. Maybe 8 years. Sold. Non-responsive. CPR in progress. Helen watches from the doorway. Her breath is shallow. The child. The paramedic doing compressions looks exhausted. 20 minutes of CPR en route. He's losing rhythm. Helen's feet move before her brain gives permission. She's in the trauma bay. No one stops her. Everyone's drowning. Attending physicians shouting orders. Nurses pulling meds. Residents intubating. Cracking chests. Running lines. The child is on the gurney in the corner. The paramedic is still compressing, but his form is sloppy now. Shoulders misaligned. Compressions too shallow. Helen steps up beside him. Switch, she says. The paramedic blinks, exhausted, confused, but he's too tired to argue. He steps aside. Helen's hands find the sternum. Correct position. 2 fingers above the xiphoid process. Her shoulders align over her hands. She starts compressions. Hard, fast, 110 per minute. Exactly. The monitor shows PEA, pulseless electrical activity. Heart's trying, but not perfusing. Epi's in, a nurse calls. Helen doesn't stop. 30 compressions. Pause for 2 breaths from the bag valve mask. 30 more. Her mind is gone. She's not in the ED anymore. She's in a blown-out compound outside Helmand, doing CPR on a 10-year-old Afghan girl, caught in crossfire, knowing she's been dead for 5 minutes, but unable to stop, because stopping means admitting it. Switch compressors, someone says. Helen ignores them, keeps going. Ma'am, you need to. Let her work, a voice cuts in. Dr. Okonkwo, standing at the head of the bed, managing the airway. She's watching Helen's form. Perfect. Textbook, unrelenting. 2 more minutes. 3. We're at 28 minutes total downtime, a resident says quietly. Should we call it? No, Helen says. Her voice is flat, absolute. Another round of epi, another 2 minutes. And then, the monitor spikes, a rhythm. Narrow complex, weak, but there. I've got a pulse, Okonkwo says, fingers on the carotid. Faint, but it's there. Helen stops, steps back. Her scrubs are soaked with sweat. The room is silent except for the monitors. The child's chest rises, falls, mechanically, ventilator-driven, but rising. Okonkwo looks at Helen. Really looks. Who the hell are you? Before Helen can answer, the trauma bay doors slam open. 2 men in uniform stride in. Not hospital security, military, army, dress blues. Crisp, formal. The first is a colonel, silver eagle on his shoulder, rows of ribbons on his chest. The second is a captain, carrying a tablet. Every head in the trauma bay turns. The colonel's eyes sweep the room, then land on Helen. Sergeant Helen Reeves? Helen's stomach drops. She doesn't move, doesn't speak. The colonel steps forward. His voice is firm, but not unkind. Sergeant Reeves, I'm Colonel David Ashford, Army Medical Command. I need you to come with me. I'm not active duty, Helen says quietly. I'm aware. This isn't a recall. It's a request. I'm working. Your shift ended 30 minutes ago. Ashford glances at the child on the gurney, then back at Helen. And from what I'm seeing, you've been working well above your job description. Dr. Chen appears from Trauma 2, blood on his gown, staring at the scene. What the hell is going on? Ashford doesn't look at him. This is military business. This is my ED, Okonkwo cuts in. Stepping between the colonel. Lonel and Helen. You don't just walk in here and… Dr. Okonkwo, is it? Ashford's tone is polite but unyielding. I have authorization from the hospital administrator and from DOD medical liaison. Sergeant Reeves is needed for consultation on a federal medical case. She can come voluntarily, or I can make this an official request. I'd prefer voluntary. Helen's pulse is hammering. What case? Ashford hands her the tablet. On the screen is a Department of Defense medical brief. Classified header. A field hospital in an undisclosed location is dealing with a mass casualty event. Explosion, structural collapse. 30-plus casualties, limited resources, surgeon and anesthesia support critically short. They need a combat medical specialist. Someone with experience in resource-limited trauma. They need her. I'm not a soldier anymore, Helen says. You never stopped being one, Ashford replies. You just stopped wearing the uniform. The room is silent. Helen looks at the tablet, at the casualty count, at the list of injuries. She thinks of the child on the gurney behind her, the one she just brought back. She thinks of Calhoun, Webb, the 34 faces in her phone. She looks at Ashford. When? Wheels up in 90 minutes. Andrews Air Force Base. You'll be briefed en route. Helen closes her eyes, breathes. Then she hands the tablet back. I need 10 minutes. Dr. Chen follows her into the hallway. You're just going to leave? Just like that? Helen doesn't stop walking. I don't have a choice. Everyone has a choice. She spins on him. Do they? You think I chose this? You think I wanted to spend 7 years mopping floors and pretending I'm no one? Then why did you? Helen's voice cracks. Because every time I close my eyes, I see the ones I couldn't save. Every time I hear a monitor alarm, I'm back in a field hospital with no blood, no power, and a kid bleeding out in my hands. I came here to disappear, Chen. To stop being the person who has to decide who lives and who dies. But you are that person, Chen says quietly. You proved it yesterday. You proved it 10 minutes ago. You can't run from what you are. Watch me. Helen, Sergeant Reeves, the colonel's voice calls from behind them. Time. Helen looks at Chen one last time. Then she walks away. In the hospital lobby, a small crowd has gathered. Nurses, residents, even some patients. Word has spread. The cleaning lady who isn't a cleaning lady. The decorated combat medic hiding in plain sight. Rodriguez is there. Okonkwo. Even Dr. Kraus, arms crossed, watching with something like vindication. As Helen walks past, Rodriguez steps forward. He salutes. It's clumsy, he's not military, but it's sincere. One by one, others follow. A nurse, an orderly, another resident. Helen stops. Her throat tightens. She doesn't return the salute. Can't. She's not in uniform. But she nods. Once. Then she follows Colonel Ashford out the doors, into the waiting car, and toward a life she thought she'd left behind. It's a bare briefing room on the edge of the airfield. Gray walls, metal table, 2 chairs, a window overlooking the tarmac where a C-130 is being prepped, engines whining in the distance. Helen sits alone. She hasn't changed. Still in her hospital scrubs. Still smelling faintly of disinfectant and old coffee. Her hands rest on the table, flat. Still, but inside, she's vibrating. Colonel Ashford gave her 20 minutes before final briefing, 20 minutes to get her head straight. She doesn't think 20 years would be enough. The door opens. Helen tenses. It's not Ashford, it's Dr. Chen. He's out of breath, still in his scrubs, visitor badge clipped hastily to his collar. "How the hell did you get on base?" Helen asks. "I told the gate I was your physician, and you'd left without critical medication." Chen pulls out a chair, sits across from her. "They let me through, barely." Helen almost smiles. Almost. That's technically stolen valor. "Sue me." Chen leans forward. "You weren't going to say goodbye." "There's nothing to say." "Bullshit. You've been hiding for 7 years. Now you're getting pulled back into the exact thing you ran from. And you're acting like it's just another shift." Helen's jaw tightens. "What do you want from me, Chen?" "The truth. Why did you leave? And don't give me the PR answer. I want the real reason." Helen looks out the window. The C-130's engines are louder now. "You ever lose someone on your table?" she asks quietly. "Twice." "Did you know their names?" Chen hesitates. "One of them. I knew all of them." Helen's voice is barely audible. 34. 3 deployments, 12 KIA. I knew their names, their hometowns, their favorite songs. I knew who had kids and who wanted them. I knew which ones were scared and which ones lied about being scared. I held their hands. I told them they were going to be fine, even when I knew they weren't. She stops, breathes. Calhoun died because I couldn't clamp a femoral artery fast enough. Webb died because an IED hit the wrong convoy at the wrong time. Private Ortiz died because we ran out of ONEG blood, and the resupply helo was grounded by weather. Specialist Kim died because I chose to intubate the soldier next to her first, and by the time I got to her, she'd bled out. Chen says nothing. "Every single one of them is in my head," Helen continues. "Every time I close my eyes, every time I hear a monitor alarm, every time I smell blood, they're there. And I can't." Her voice breaks. "I can't keep doing it. I can't keep being the person who decides who lives and dies, and then lives with the ones I got wrong." "So you became a janitor." "I became invisible. That's not living, that's just existing." Helen finally looks at him. Her eyes are red but dry. "It's all I have left." Chen leans back, silent for a moment. "Then, you saved that kid today. The child in the trauma bay. You know that, right?" Helen doesn't answer. 28 minutes of downtime. No one else would have kept going. But you did. And that kid, 8 years old, named Sophie, by the way. She's upstairs in the PICU right now. Sedated, stable, neurologically intact, because of you. Helen's hands curl into fists. "One save doesn't erase 34 losses," she whispers. "No, but it's one more name you'll remember for the right reason." Helen closes her eyes. Another knock. The door opens again. This time it's the contractor from the lobby, the man who recognized her. He's still in his field jacket, visitor badge hanging crooked. Chen stands. "I should go." "No, stay." The contractor steps inside, closes the door. He looks at Helen. "I owe you an apology for outing you. I didn't think." "It's done," Helen says flatly. "I know, but I need you to know something." He pulls a chair, sits. "After Salerno, after you patched me up, I got out. Quit contracting, went home. I've got 2 kids now. I coach Little League. I teach CPR at the community center." He pauses. I'm alive because you didn't quit on me when I was bleeding out in the dirt. And every single day, I get to see my kids because of that. So whatever you think you are, whatever you think you failed at, you need to know you didn't fail me. Helen's throat tightens. I'm just one guy, he continues. But I'm one guy who's here because of you. And I'm not the only one. You saved dozens, maybe hundreds. You don't get to erase that just because you couldn't save everyone. Helen looks down at her hands. Their names, she whispers. I can't forget their names. You're not supposed to, the contractor says. That's what makes you different. That's what made you good at this. You remembered. Most people compartmentalize. You carried them. And yeah, that's heavy as hell. But it also means every person you saved mattered. They weren't just numbers, they were people. Helen's breath hitches. For the first time in 7 years, she feels something crack inside her chest. Not breaking, opening. Colonel Ashford enters. He sees the crowd, raises an eyebrow, but says nothing about it. Sergeant Reeves, we're wheels up in 10. I need your answer. Helen stands, looks at Chen, at the contractor, then at Ashford. What happens if I say no? You go back to your life. We find someone else. No repercussions, no judgment. And if I say yes, you get on that plane. You do what you were trained to do. And when it's over, you come home. No obligation beyond this one mission. Helen is silent. She reaches into her pocket, pulls out the tungsten ring. Wed's ring. She's worn it on a chain around her neck for 7 years. Hidden, carried. She looks at it, really looks at it. Then she puts it back in her pocket. I'll go, she says quietly. But not because I'm running towards something. Because I'm done running away. Ashford nods. That's all I need. At the edge of the tarmac, Chen walks with her toward the C-130. When you get back, he says, we're having a conversation. About you. About what happens next. I'm still just a janitor, Chen. No, you're not. You never were. He stops, looks at her. You're a combat medic with 7 years of OR observation and more trauma experience than half my attendings. You're what we call overqualified. Helen almost laughs. Almost. We'll see. She starts toward the plane. Helen, Chen calls. She turns. Bring them home. Helen nods. Then she climbs aboard. The engines roar. The ramp closes. And Helen Reeves disappears into the sky, toward the thing she's been running from for 7 years. Toward the place where 34 names wait. And 31 more need saving. Helen walks through the front doors of St. Catherine's 6 days later. She's thinner, exhausted. There are shadows under her eyes that weren't there before. Her duffel bag hangs over one shoulder, military issue, still dusty. She doesn't go to the maintenance office. She goes to the administrative wing. The hospital CEO, Dr. Laura Voss, is waiting in her office. With her, the chief of surgery, the head of emergency medicine, and Colonel Ashford. Still in uniform, Helen sits. Sergeant Reeves, Dr. Voss begins, her tone carefully. Welcome back. Colonel Ashford has debriefed us on your recent activities. Helen says nothing. You were involved in a classified medical operation overseas. 43 casualties, limited resources, 16-hour sustained trauma response. According to the colonel, you were instrumental in saving 31 lives. Helen's jaw tightens. 31 saved, 12 lost. The numbers are already carved into her bones. Voss leans forward, which brings us to a complicated situation. You've been employed here as a sanitation worker for 7 years. During that time, you concealed your medical background, your military service, and your qualifications. Last week, you intervened in 2 active medical cases without authorization. I saved 2 lives, Helen says quietly. You did. And that's the only reason we're having this conversation instead of a termination hearing. Voss pauses. But we need to address what happens next. I'll resign, Helen says, effective immediately. That's one option. Voss glances at Ashford, then back at Helen. Or you accept a formal position. We're prepared to offer you a role as a trauma surgical technician, pending certification review. Your military credentials transfer. You'd be working directly with our surgical teams. Helen blinks. You're offering me a job? We're offering you the job you should have had 7 years ago. The chief of surgery, Dr. Thattel, speaks up. You've been watching our ORs for nearly a decade. You know our protocols, you know our people, and frankly, after last week, we'd be idiots not to use you properly. Helen doesn't know what to say. There's a condition, Voss adds. You undergo a full psychological evaluation, and you agree to regular counseling. What you've been through, what you're carrying, that's not something you can just bury. Not anymore. Helen looks down at her hands, the hands that saved 31 lives 6 days ago, the hands that still tremble when she's alone. I'll do it, she says. Dr. Chen is waiting outside Voss's office when Helen emerges. So, he asks. I'm staying. Chen grins. Good, because I already put you on the OR schedule for tomorrow. Helen raises an eyebrow. Confident? Realistic. He pauses. Then, I owe you an apology. For last week, for pushing, for not seeing how hard you were fighting just to stay standing. You didn't push, you saw me. That's worse. Or better. Helen almost smiles. Rodriguez appears jogging down the hall. Dr. Chen, oh, ma'am, you're back. He looks genuinely relieved. We heard about the mission. 43 casualties? 31 saves, Helen corrects quietly. That's incredible. It's 31, Helen repeats. Not incredible, just counted, just carried. Rodriguez nods, understanding something in her tone. For what it's worth, we're glad you're here, really here, not just mopping floors. Helen doesn't know how to respond to that, so she just nods. Over the next 3 weeks, the hospital changes around her. Small things at first. The residents start asking her questions during rounds. The surgical techs request her input on tray setups. Dr. Okonkwo pulls her into an OR to assist on a difficult trauma case, and afterward, asks her to scrub in regularly. Helen moves through the hospital differently now. Not invisible, not hidden, seen. It's terrifying, but it's also something like relief. Twice a week, Helen sits in a small office on the 3rd floor with Dr. Miriam Holt, the hospital psychologist. At first, Helen doesn't talk, just sits, breathes, holds the tungsten ring in her hand like a talisman. But slowly, over sessions, the words come. I thought if I stopped being Sergeant Reeves, I could stop remembering. Did it work? No, I just remembered alone. Dr. Holt nods. What if the goal isn't to stop remembering? What if it's to remember differently? Helen doesn't answer, but she keeps coming back. One night, Helen is assisting in OR 3, GSW to the abdomen. Young man, early 20s, caught in crossfire. It's bad. Liver laceration, IVC injury, massive hemorrhage. The attending is struggling, losing control of the field. Helen's hands move automatically. Pringle maneuver, packing, manual compression. She's calling for instruments before the surgeon asks, adjusting retractors, managing the field like she's done it 1,000 times. Because she has, they save him. Afterward, in the scrub room, the attending, Dr. Marcus Lowe, 50, former Navy, looks at her. You've done this before. Real combat, not simulation. Helen nods. How many? Too many. Lowe strips off his gloves. I was a Navy trauma surgeon. 2 tours, Iraq. I get it. He pauses. It doesn't go away, the weight. But it gets easier to carry when you're not carrying it alone. Helen looks at him, sees the same shadows under his eyes, the same careful control. Thank you, she says. For what? For not pretending it's fine. Lowe nods. It's never fine, but we show up anyway. Dr. Chen finds Helen in the staff lounge one afternoon. I need to tell you something, he says. Helen looks up from her coffee. I was wrong, about modern protocols being better, just because they're newer, about dismissing experience because it doesn't fit the latest algorithm. He sits across from her. You were right, about the Pringle, about technique, about the fact that sometimes the old ways work because they're based on things that don't change. Anatomy, physics, pressure. You're a good surgeon, Chen. You'll figure it out. I'm a better surgeon because you didn't let me kill that kid. Helen is quiet for a moment. Then, you would have figured it out. Maybe, but he might have died first. Chen leans forward. I'm asking to scrub in with you, whenever I can. I want to learn what you know, the stuff that isn't in textbooks. Helen meets his eyes. You sure? It's not pretty. Neither is losing patience because I was too arrogant to listen. Helen nods. Okay. 1 month after her return, Helen receives an envelope in her hospital mailbox. Inside is a handwritten letter from Sophie's mother, the 8-year-old from the trauma bay. Dear Helen, I don't know if you remember my daughter, Sophie. You brought her back when the doctor said it was too late. You didn't give up on her. She woke up 3 days ago. She's talking, laughing. She asks about the nice lady with strong hands who helped her. I don't have words big enough to thank you, but I'm trying anyway. You gave me my daughter back. You gave her a future. I will carry that gift for the rest of my life. Thank you. Helen reads it 3 times. Then she folds it carefully, puts it in her locker, next to the photo of her unit. 34 names she carries, and now one more. But this one doesn't feel like weight. This one feels like air 14 months later. Helen stands at the front of a packed auditorium. Medical students, residents, attendings, even a few nurses and paramedics in the back rows. She's in scrubs, clean but worn. The same ones she wore a year ago, mopping floors. But now there's a hospital ID badge clipped to her collar. Helen Reeves, trauma surgical specialist. On the screen behind her, field trauma management, lessons from austere environments. She doesn't use notes, doesn't need them. When resources are limited, Helen begins, her voice steady. You don't have the luxury of waiting for the perfect tool or the ideal conditions. You have what's in your hands and what's in your head. And sometimes, that has to be enough. She clicks to the next slide, an image of a Pringle maneuver. This technique is over 100 years old. Some of you have been taught it's outdated, slow, inefficient. She pauses. It's not. It's fundamental, because when you can't see the field, when blood is everywhere, and your patient is dying, this buys you time. And time is the one thing you can't get back. In the third row, Dr. Chen sits with his arms crossed, nodding. In the back, Dr. Kraus watches with something that might be approval. Helen continues. For 90 minutes, she teaches. Not from textbooks, from memory, from scars, from the 34 names and the 31 saves, and every moment in between. When she finishes, the room is silent. Then someone starts clapping. It's Rodriguez, now a second-year resident. Others join. The applause builds. Helen doesn't smile, just nods once, steps down from the podium. After the lecture, Helen walks the same route she used to walk every morning, through the surgical wing, past the ORs, down the corridor where her mop cart used to squeak. She stops outside OR 5, the same room where Chen almost lost the splenectomy patient. Through the observation window, she sees a surgery in progress. Dr. Okonkwo is teaching a resident, explaining, demonstrating. The resident's hands move carefully, deliberately. Helen watches for a moment, then moves on. Behind the hospital, there's a small memorial garden, stone benches, plaques for donors and staff who've passed, a quiet place few people visit. Helen comes here every week. She sits on the same bench, pulls out her phone, opens the photo folder, 34 faces. She looks at each one, says each name aloud, quietly, a ritual, a remembering. When she finishes, she opens a new folder, one she started a year ago. Sophie, the 8-year-old, smiling in a photo her mother sent, alive. The splenectomy patient, recovered, sent Helen a thank you card from college. The contractor from the lobby, Christmas card every year, photos of his kids, 31 names from the field mission, faces she'll never forget. She doesn't know all their stories, but she knows they're alive. That has to be enough. Footsteps on the gravel path. Helen looks up. It's Dr. Chen. He has 2 coffees, hands her one. Thought I'd find you here. It's quiet. Chen sits beside her. You ever regret it, coming back, staying? Helen is quiet for a long moment. Every day, she says honestly, and not at all. That makes sense in a way that shouldn't make sense. Helen almost smiles. How's your hepatic resection schedule looking? Booked, thanks to you. Kraus says I'm finally learning to respect the fundamentals. High praise. From him, it's a knighthood. Chen sips his coffee. We got another trauma fellowship applicant. Former Army. Did 3 tours as a medic. She's been working as an EMT for 2 years, too scared to apply to medical programs because she didn't think anyone would take her seriously. Helen looks at him. And? I told her about you, about what you did, about how you went from mopping floors to teaching surgical residents. Chen pauses. She's applying, because of you. Helen's throat tightens. You're not invisible anymore, Helen. We're a standard. You're proof that it's possible to come back. I'm just doing the job. No, you're doing your job, finally. Helen's pager buzzes. Trauma activation. Multi-vehicle accident. 5 minutes out. She stands. Chen stands with her. You ready? He asks. Helen checks her watch. The same scratched military watch she's worn for 15 years. Yeah, she says. They walk back toward the hospital. Side by side, surgeon and specialist, partners. As they push through the doors, Helen feels it. The weight she's carried for so long. It's still there. The 34 names, the 12 losses, the scars. But it's balanced now. By the 31 saves. By Sophie. By the students she teaches. By the woman who's applying to med school because Helen showed her it's possible. The weight doesn't go away. but she's not carrying it alone anymore. Inside the trauma bay, the organized chaos begins. Monitors, orders, motion. Helen gowns up. Gloves snap on. She steps to the table. A young resident looks at her, nervous. "Ma'am, I've never done a thoracotomy." "You will today," Helen says calmly. "I'll walk you through it, step by step." The resident swallows, nods. The patient arrives, GSW to the chest, pressure dropping. Helen's hands don't shake. They never do. Not anymore. "Scalpel," she says, and the work begins. The monitors beep. The resident's hands move under Helen's guidance. Steady, precise, learning. Outside, through the trauma bay windows, the sun is setting over the hospital. Golden light cuts through the glass, illuminating the organized chaos inside. Helen doesn't notice. She's focused, present, doing what she was always meant to do, saving lives, one at a time, with hands that remember 34 names, but are building a new list now. A list of people who lived, because she didn't give up, because she came back, because sometimes the weight you carry is also the thing that keeps you standing. The patient stabilizes. The resident exhales. Helen steps back, strips off her gloves. "Good work," she says. The resident beams. Helen walks to the scrub room, washes her hands, looks at her reflection in the mirror. 53 now. Gray hair, tired eyes, but not invisible. Not anymore. She dries her hands, checks her watch. Another case in 20 minutes. Helen Reeves, sergeant. Janitor, ghost, walks back into the light and keeps going. Because that's what you do. You show up, you remember, and you save the ones you can. Helen Reeves continued working at St. Catherine's Hospital for 12 years. She trained over 200 residents and surgical specialists. In 2032, she was awarded the hospital's Lifetime Excellence in Trauma Care. She never stopped carrying the 34 names, but she added hundreds more, for the right reasons.